The Affordable Care Act was signed into law just over 12 years ago, on March 23rd of 2010. It was historic legislation to connect more individuals to the health care and coverage they need and deserve. One of the goals also was to add more people to insurance, to grow the risk pools, and start working at bringing down the costs of insurance. The Affordable Care Act established a standard of comprehensive coverage with essential health benefits. It eliminated discrimination against people with pre-existing conditions and included lots of cost containment measures. It's also responsible for provisions like dependent coverage, being able to keep your children on your insurance longer, Medicaid expansion, changes to employer-sponsored insurance, anti-discrimination rules, some Medicare prescription drug savings, rate review and medical loss ratios, transparency, and additional reviews. And we're talking about medical loss ratios just as an example. That requirement says that the premiums you pay must be spent on medical care expenses, or you get a rebate. And the state of Wisconsin's insurance commissioner says that resulted in about $50 million in rebates to Wisconsin consumers just in 2020 alone. Now, as we know, the Affordable Care Act was critical during the COVID pandemic. The Biden administration announced a record-breaking 14.5 million people signed up for 2022 healthcare coverage in the most recent open enrollment period, one that was kept open a little longer by the Biden administration. The administration says they invested in community outreach, navigators, champions for coverage, and extensive advertising to make those connections. And they also credit the American Rescue Plan Act for bringing down the cost of premiums for a lot of those individuals that found their way to HealthCare.gov. The U.S. Department of Health and Human Services Office of the Assistant Secretary for Planning and Evaluation also released a report that showed the uninsured rate fell in 2021 after the American Rescue Plan and these outreach efforts took effect. In a statement, the Centers for Medicare and Medicaid Services Administrator Chiquita Brooks-LaShore said, on the 12th anniversary of the Affordable Care Act, it is clear that the Affordable Care Act and the American Rescue Plan are working to expand access to health care coverage and have been critical to advancing health equity. In a separate statement, Wisconsin's Governor Tony Evers says every Wisconsinite should have access to quality, affordable health care. The Affordable Care Act has been critical to this work, but he says there's more work to be done to expand access to affordable health care. We must keep fighting to protect the Affordable Care Act, he says, and whether it's expanding Badger Care, addressing health disparities in communities of color, or investing in public health and healthcare infrastructure, we must affirm our work building healthier families and communities across our state. So 12 years after the Affordable Care Act is signed into law, we know it's got staying power. It appears that the years of persistent debate on the law are largely over. Polls consistently find that the majority of Americans approve the law, and it's hard to take healthcare coverage away from those 14.5 million individuals that are now insured thanks to HealthCare.gov and the health insurance marketplace. So 12 years of data on the impact of the Affordable Care Act is also showing us that it is making huge gains in reducing disparities, reducing poverty, and connecting more people to coverage. And in a time of crisis like the current COVID pandemic, we know improved access to healthcare and coverage is a necessity. If you are still looking to connect to healthcare coverage, HealthCare.gov would be a good place to start. They also have a Find Local Help feature on HealthCare.gov to find an assister that can help you evaluate your healthcare coverage options. In Wisconsin, Wiscovered.com can do the same. In the description below, we link to a lot of the data sources we referenced today.